today I'm going to talk about some digital diabetes apps that I use in clinical practice. I'm Dr. Om J. Lakhani. I'm a consultant endocrinologist at Zydus Hospital in Ahmedabad. I'd just like to say that a financial disclosure, I am an advisor for the 7 Sugar app, which we'll be discussing in the following slides. So the apps that I use, 5 apps that I use daily in my clinical practice are Dipole. Second is the 7 Sugar app, the GLIMPAP app, the Insulin IP calculator, and the WhatsApp. Right? So these are the ones which form a part of my daily diabetes clinical practice. Let's first talk about Dipole. So Dipole is an open source, free application. What it basically does is it takes data from various devices. Like for example, it takes data from your Libre Pro device. It also can take data from a lot of glucometers. Some of these glucometers are available in Indian market. So all you have to do is you have to download this Dipole app on your PC or your MacBook, and then you have to connect your device via USB cable, and then for the relevant patient you add the detail. For example, in this case we have selected adding detail for Abbott Freestyle Optimum Neo, right? That's the glucometer. So you can use whatever device you have. You can also, like I said, use it for your Libre Pro. And once you upload the data, it creates a beautiful AGP, that's the ambulatory glucose profile. The good thing about it is that it gives you more details. So it gives you the usual Abbott Libre Pro software only gives you a limited range. Here it gives you more details, like it tells you the timing range, that is the range between 70 to 180, then again 80 to 250, and again value more than 250. It also tells you lower values, that is 54 to 70, and less than 54, that is level 2 hypoglycemia. So this is what it tells you. It gives you the average glucose, which of course your Abbott device also gives you. Tells you how many what percentage of sensor use. It tells you about GMI, that is the glucose management index, the standard deviation, and the coefficient of variation. This is what is really impressive, that tells you the data about glycemic variability. All this is free. Also, the good part is that whatever the data that is collected, it tells you, it can combine the data from your glucometers with the SMBG data and give you a more robust data for your patient for your regular use. The patient themselves can upload the data through the software and add you as a provider, and you can always access the data of the patient whenever you feel convenient. So this is the great part about Dipole. The second app which I'm going to talk about is the 7 Sugar app. The 7 Sugar app, I'm an advisor for this company. This is a app, or rather a platform for seamless diabetes management, and this is actually, it's a complete platform for diabetes management. So it talks everything about right from onboarding of the patient to using CGM also. This is the doctor side of it. So whenever a new patient is added, you can have a look at whatever the patient's details are from this. You can chat with the patient like a WhatsApp, right? So you have a 7 Sugar chatting system. You can also use teleconsultation. So this is an inbuilt teleconsultation platform also. So let's say you don't need a separate teleconsultation app or a software. You can directly do it using the 7 Sugar app. And from the patient side, it tells you a lot of, you can enter your SMBG data. More importantly, you can click the photo of the food that you're going to take, and at the back end it calculates the calories, carbohydrate content, the macronutrient content of the food, and it directly incorporates that in your data. So when I'm collecting data from SMBG or when I'm collecting data from CGM, it also adds the food aspects of it, and it tells you that what food led to a glycemic peak, what food led to there was an insulin glucose mismatch leading to hypoglycemia, and so on and so forth. So it tells you a lot of insights into the CGM, also SMBG. So this is the great part of the app. This is the meat of the app. This is the best part of the system. So they are also developing AI system, that is artificial intelligence, which which can then predict the glucose value in future. So if I'm going to eat a particular food, let's say I'm going to eat a pizza, it will tell me that what the sugar will be in the next few hours after eating that pizza, it's looking at my previous glucose values. So this is the great part. It's a great app, and if anybody wants to use this as a platform, you can send an email to me. This is my email. We'll connect you with the providers of this app. Then is the GLIMPAP, and again this is an app which I use daily in my clinical practice. Now I made a detailed video review of the GLIMPAP and how to use Abbott Libre Pro with the GLIMPAP. It's available on my YouTube channel, that is Endocrinology India. But apart from that, in this, what I'm going to talk about is that GLIMPAP is a third-party software that can take data from your Abbott Libre Pro. Now, for those who use Abbott Libre Pro, they know that it's a professional CGM, that is, it is retrospective CGM. So it will give you the data only after the patient's 14-day glucose control, as the 14 days are over, and then you can download the data. But if you use the GLIMPAP, you can take the real-time data from your software. It uses NFC, so it can directly take data from your Libre Pro, and it can make a graph like this. Also, you can add your SMBG values, and what it does is by calibrating with your SMBG values, it gives an extremely accurate glucose reading, and hence GLIMP is something which can eventually replace your Libre Pro reader, and again, of course, if you're an avid user of CGM, this is very, very useful. An app that I use daily in my clinical practice for my ICU patients or for my critically ill patients on insulin infusion is this insulin IP calculator. What it tells you is this uses the Yale algorithm for infusion algorithm for calculating the glucose, calculating the insulin infusion dose. So you need to enter the current glucose value, the previous glucose value, the time between the readings, and the current infusion rate, and then you click on calculate and it will give you the corrected infusion rate which you have to give. It's a very smart app. If you are developing hypoglycemia, it will also tell you how to correct the hypoglycemia. It tells you the logic also. So it says that the blood glucose change in this case was the blood glucose reduced by 60 milligram per deciliter. Hence the insulin infusion rate should change by 0. So what you're doing is currently right. It is falling at an appropriate rate, so there's no need to change the insulin infusion. So this is the insulin IP calc. And of course, I think the most importantly, the app that I use every day in my clinical practice is the WhatsApp app. You cannot do without it. I think in today's world, WhatsApp is the sine qua non of diabetes management. Your patients are very comfortable using WhatsApp. I've had patients, the most illiterate patients from rural most areas, still using WhatsApp. They're able to communicate the sugar values to me by WhatsApp, and we can then adjust the dose of insulin or medicines. You can see an example of a recent patient here. So I thank you all for your patient listening, and have a great day.